So, with all your permission, dear doctors, we are starting the session now. So, may I have your attention, dear esteemed faculties and delegates? I would like to take a few moments of your time to introduce myself and the distinguished faculty members of this session. A very good afternoon and a warm welcome to all the dignitaries present over here today. I am Rituparna from Clarinet, serving as an allocated session assistant to ensure a seamless experience. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clarinet serves as a digital partner for this online event hosted by the National Neonatology Forum Gujarat State Chapter. And the focus of today's session is lessons from the experts, multidisciplinary management of Down syndromes. Now, without wasting any further minute, let's begin today's session, for which I would like to invite Dr. Kunal Ahiya, sir, the Honorable Secretary of NNF Gujarat Chapter, to start the event today with his enlightening words and for the further coordination. So the dice is all yours, sir. Please proceed.
Thank you, Ritu. So today we'll welcome Dr. Neena ma'am, and the topic is multidisciplinary management of Down syndrome, as this is the birth defect month, awareness month. So we'd be honored to have you, ma'am. I would request Shwetal Bhatt ma'am, our president of NNF Gujarat State, to say a few words.
Thank you, Dr. Kunal. At the outset, thank you so much, Dr. Neena ma'am, for accepting our invitation for this expert talk. It was pleasure to invite you on this platform. I have been hearing on our alumni group. I used to see your post and I was really eager to meet you. So online platform, and I would like to see this multidisciplinary day by day, more and more diagnosis of Down syndrome we are able to make because of easy availability of the karyotyping and identification and all that. So, but then once the baby, like I always talk to my resident, that once the baby is diagnosed and it's discharged, then what? It requires a follow-up care and multidisciplinary approach where the pediatrician is a nodal person. So, ma'am, you are an expert in this field, and so we would like to hear from you about how we can overall take care of the Down syndrome. Thank you so much, ma'am, for accepting the invitation. Over to Dr. Monish, sir, for detailed CV detail of Dr. Neena ma'am, how she has been working with this organization since long. So, Monish, sir, over to you.
Thank you, madam. Great pleasure to introduce Dr. Neena madam. Like she has worked very dedicatedly for this community of the Down syndrome, and what she has done, many of these, in short, like I will just go for this. She has done his graduation from BJ Medical College in 1982 to 88, and postgraduate also from the BJ Medical College, Ahmedabad, from 1988 to 91. For working, she is working as a private practicing at the Sesau Children Hospital at Navsari from 1991 onwards. In 2003, she has taken adolescent training from Indian Academy of Pediatrics, New Delhi, and from 2001 to 2002 for the postgraduate child psychology from MSU, Baroda. In the field of Down syndrome, Madam has many achievements for more than 2 decades into the field of disability sectors. She is a pioneer to start inclusive play, inclusive festivals, inclusive culture program, and inclusive picnics. One of the 4 doctors of the Central IB team to produce a leaflet of the guideline for the Down syndrome. Received a national award for the Down Syndrome Federation of the India for conducting more than 400 online sessions for the Down syndrome community during the COVID time. Award of the National Conference of the Down Syndrome Federation of the India at Raipur. And first person globally to conduct a 12 days mountain workshop at Kathmandu, Nepal for children with the special need. Workshops include independent accommodation for the children, physical activity, and living in the mountain and tents. Received an award and recognition certificate in the category of unsung heroes of the satellite services for Down syndrome in Kuch Pedicon State at December 2022 at Ahmedabad. Award at the best service rendered in the family having the person with the Down syndrome in September 2022. Invited as one of the mentor of Asia Pacific Down Syndrome Federation in December 2022. Invited as a guest speaker at the National Trust India International Down Syndrome Conference at Nai Disha, conducted a workshop at Indore in 2017 for children on the autism spectrum and their parents. several Down syndrome awareness programs in major cities of Gujarat by distributing the pamphlet, doing road show posters and flash and mobiles as a cyclothon. Organized an international film festival in Navsari in 2015 to bring the awareness to inclusion the slow learners in the society. Conducted a doctor awareness program in Navsari, more than 300 online sessions during the COVID-19 of the time. Started a new YouTube channel for the name of the Ninas the Nux with the small practical tips. Started junior Swasaksam life skill program for the children between 10 to 15 years, and the senior Swasaksam batch for the enhance the learning of this batch. Around 70 teens per year are trained through this program. Conducted several online parenting sessions associated with the theater group of the Bhopal for adult Down syndrome and made them learning acting skill. Sir, activities like started open house called from July 2023, the major cities of India, organizing a pan-India 3 days residential workshop for the kids of the first time in March 2023 for the teens and adults for the Down syndromes. Doing a lot of work in the field of counseling parents, different modalities of constitutional learning, adolescence care, regularly conducting a teachers training program for the major cities of mainly like Gujarat and outside, partially outside the Gujarat. Started doing work for the children and autism spectrum, regular delivering the lectures in a different social the circles and organizing regarding inclusive services, conducting a regular personal counseling, regularly writing up blogs for the training and development of children with the Down syndrome and regularly uploading the videos on YouTube for the same names. Thank you, madam, for joining our stage, and I welcome you for this your talk and your views. Thank you, madam.
Thank you very much. Thank you. Am I audible?
Yes, ma'am.
Okay. So good afternoon, everyone, and thanks to Gujarat National Neonatology Forum for having such an innovative concept of neonatal. We have established Masti Ki Pathshala for our children, and I am pleased to read this neonatal Pathshala. Thank you all the dignified office bearers. Thanks Dr. Shwetal for giving me an opportunity to talk here in front of the most intellectual audiences about those. And I hope I am audible. Hello? I hope.
Yes, you are audible, madam.
Okay, fine. I can't see anyone. The videos are, so I could not judge whether I am audible or not.
No, ma'am, you are audible.
Okay.
And most of the viewers will be joining through the YouTube. This is a faculty link, so you may not be able to see all of us.
Okay, I got it.
Okay. Thank you, ma'am.
Since we here the audiences all are doctors and particularly all are pediatricians, I need not tell anything about Down syndrome as far as the medical part is concerned. We all know the medical aspect, as Nelson has already taught us what Down syndrome is actually and how it happens and what actually happens. But before jumping to the topic today, multidisciplinary approach, being a pediatrician, I would definitely like to talk a little about the strengths of a person with Down syndrome because being a pediatrician, we need to know that what a person, what a child, what a teenager, what an adult with Down syndrome, when it what he or she can do. About the strength of a child, a grown-up, a young adult, or an adult syndrome can do. What are their abilities, or their strengths? Because till now, pediatrician, we know about their limitations. They can't do high cognitive functions. They have some the complex thinking is involved. Can't do hierarchical things. So all these are the things we know. We are not aware about their abilities, strengths. If we know we can help, we can guide the parents their strength maximally, so they can lead a with very minimal support, they can live an independent life. So here I would like to share my presentation with you. Is just about me. I am a BJite, and these is children with Down syndrome. Down syndrome. They are highly trainable. They are they are visual learners. So I would you to know a few things about children with Down syndrome. Apart from associated medical conditions like these thyroid malfunctions, hearing and visual and system issues with digestion, joint problems, muscle weakness, low muscle power. They are very good visual memory. They remember things when seen, when demonstrated, when shown in diagram. They remember for a long time, and if repeated, they can remember for lifetime. This is one strength we can use very positively. And if we guide parents about this, if we inform parents about this can be used very constructively. Then they are copycats. So whatever we want them to do, if a role model is provided, if somebody is doing exactly like that, it is very easy to make them learn those things, because they just copy. Their social quotient and emotional quotient are higher than the peer of same age, than peer. Before today or before days, there was some article in Sundays where exactly opposite was mentioned. I today itself, and I called Dr. Bhupendra as well, that this is wrong information provided to parents. It has mentioned that આ છોકરાઓ સામાજિક ધોરણે એટલું ભળી નથી શકતા, which is not the fact. They are very good socially. Their social communication is very good. They remember people. They remember the likes and dislikes of person they meet, and they remember for a longer time. So their social quotient and emotional quotient is higher than the typical peers. They they are keen observant. Their receptive ability is very good. So whatever they see in their environment, they grab it, they learn from the environment, because their receptive ability is very good. Again, we can guide parents to use this ability. They do best in a predictable schedule. I will come to the role of a pediatrician, but I would like to know all the pediatricians present here about this strength, because we will be able to guide parents accordingly. Then and then, between therapist and parents, you can intervene as pediatrician, and you can provide these therapists, because therapists are not trained specifically ASD or DAS or ADSD manner. So if we of Down syndrome, then things can go better in a better way. So they do best in a predictable schedule. So if the predictable schedule is provided, they go even a half an hour here, even an inch here or there. So they are best in a predictable schedule. But one thing we need to keep in mind, they take literal meaning, because they can't read in between the lines. Smile, they can't make out whether my them, whether my smile was a smile because was it a sarcastic smile, they can't. So they are more productive. There are many private adult with Down syndrome as their employee because they are more productive. They don't know if sir is not, the boss is not watching, you can leave, you can do play some mischief. No, it is not there in them. They are not made like that souls. And if they just follow instructions, so if instructed that your working hours are from 9 to 5 and you will get a break from 12 to 1, you will get a lunch break, they will exactly follow that. So they are more productive and they love monotonous work, so they can do very good. So they can you can as a pediatrician, as a doctor, maybe as a family person, if you have someone in your family, in your neighborhood, you can suggest such type of workplace where they have to just do a monotonous work. They are best doing monotonous work. These are few strengths about Down syndrome I wanted all of you to know. Then coming to the multidisciplinary approach as a pediatrician, I would like to go to next slide. Just a minute, let me do it full screen. Okay. So the first transition is at birth, and I was informed that most of the audiences here are fourth year pediatricians. So you must be practicing as a neonatologist also, and all the pediatricians they do neonatology practice as well. So during this transition, the emotional transition, we are the only one present there. We are the only one present. Think about the parents, the long awaited moment of celebration. They were waiting for the baby to be born. And when we inform that your baby is not normal, or your baby is having some issues, or your baby will not grow as in accordance with the typical babies, so what will happen to them? So this is the first transition, and I have named it the emotional transition. It is very difficult when a moment of celebration is takes totally different turn, and suddenly the parents they are into pain and agony and confusion and stress and denial. No, it can't happen to us. We have not done anything wrong with anyone. Why that should happen to us? So the denial mode, frustration, and whatnot. And person naturally they will start finding out faults with the other family. The parents of mom will start finding faults with the father's family, and vice versa. So this is very critical moment, and we, the neonatologists, the pediatricians, need to be very sensitive at this particular moment. We need to be very sensitive. We need to be very careful revealing the news to the parents. And each birth is worth celebrating. हर एक बर्थ, एक कोई भी बच्चा जन्मता है वो सेलिब्रेट होना ही चाहिए. Each new birth is a moment to be celebrated, and we can't steal this moment from the parents. So we need to be very careful at this particular moment, the moment of celebration, and we must congratulate the parents having a new for the new arrival. And whatever is to be done, we will be doing it later on, because this is the situation when parents, when the news is revealed that your baby, the newborn baby, is having some genetic issue or is having some problem. So it is the situation is just like supported triangle trying to get supported on the tip. The situation is exactly like this. The situation is exactly like this. A triangle trying to stand on the tip without support. And what can do? What the society can do, that will come later. But what on first hand, what a pediatrician can do. So I have I have supported the triangle, unsupported triangle with few pillars, and you can see the first two pillars are family members. So family, both side family members need to be supportive, and doctors on first hand pediatrician. So it's our duty, the duty of a pediatrician to do a family counseling, to uh, to reveal the news, maybe not immediately, but seeing the situation. The first thing to be done by a pediatrician is counseling of parents. And not only parents, the family members, because the first two pillars would be the family members, both sided family members and the pediatrician. And we will try our level best to provide them the positive side of the syndrome. And then medical checklist. I need to go into the detail of medical. The first and foremost thing is to be done cardiac screening, and then comes thyroid screening and vision and hearing and blood count and checking the patency of digestive system and everything. So we have to provide them with the medical checklist to be followed. Then national immunization schedule, because many parents they are skeptical about going through. We have to convince them and training them about the national immunization schedule is a duty of a pediatrician. About breastfeeding, latching is very important, but because we all know that the extra chromosome bring along, the major thing is lower muscle tone and low muscle power. Because of that, there is poor muscle coordination, and as all the voluntary involuntary muscles involved, they are weaker in strength. Naturally, the latching and the sucking would not be strong enough to suck the breast milk. So the alternate ways to feed the baby, the position, the putting of thumb, teaching the mom how to help the child to suck in a better way. There are all chances that that child will not be will not be swallow, because there is a problem with muscle coordination. So everything, all these things we need to inform to mom of what are the things she can help the child so that the child feed most of the time directly through breast, and if not, then how to get the breast milk, how to extract the breast milk, and how to feed the newborn baby with that. So about this is very important aspect, teaching the mother about breastfeeding. So these are few things we need to take care immediately after birth, and few days after, maybe not few days, few months, the pediatrician need to guide the parents about various therapies. Collectively as early intervention program. Five main heading program. This is the job of occupational therapist, special educator, I know physiotherapist and speech therapist, but here I'm going to mention what a pediatrician should know about early intervention program. A pediatrician should know what they should explain, because all the terminologies are overwhelming for parents. Parents, they just get, overwhelmed, confused, frustrated. Ki what is happening in their life, because physiotherapy, then occupational, what occupational therapy means, they definitely they don't know. What speech therapy, oromotor exercises, if they start searching on internet, they will come across uh, all these terminologies, and they will be very, very much confused, and they will get frustrated. So the job of a pediatrician is to simplify, each one of these. So physiotherapy is nothing but exercise of bigger muscles. So make it very clear to the parents that don't worry, don't get stressed out reading the big terminologies. Physiotherapy is exercise of bigger muscles, limb muscles and trunk muscles. Occupational therapy is exercise of smaller muscles. Activities involving smaller muscles, child to and which eventually help the child to learn self-help skills and writing skills. So make all the terminologies simple. Then connect them with the appropriate therapist, or if parents are not affording, we can even empower parents to become a therapist. All these therapies are possible during doing day-to-day activities. So no need, if they can't afford, therapists are not available, we pediatricians empower the parents to become therapists. Then speech therapy is nothing but oromotor exercise, so exercise of lips and buccal, cheek muscles, and tongue exercise, and breathing exercises. So speech therapy involves oromotor and breathing exercises. Sensory integration, this terminology, so many parents, they get so much confused reading this. What is sensory integration? Sensory integration is nothing but making optimum use of all 7 senses. 5 we all know, 6th is body balance, and 7th is body awareness. So simplify. Sensory integration means make use of all the senses as much as you can. So sense of vision, many colors, exposure to colors, exposure to fluorescent light, to moving objects, and the sense of vision is activated. Sense of smell, sense of taste, and sense of touch, making the child touch various textures. So provide them with texture books, texture wall, texture floor. That is the job of a special educator, occupational therapist, and the center people. But making this thing understandable, easy, making it easy for parents to understand is the job of a pediatrician. And then coming to foot arch, the moment the child starts standing without support, foot arch is mandatory. We need to explain why, because otherwise the weight will fall unnecessarily on the hip joint, knee joint, and ankle joint, and the degenerative process will start earlier. The gait will not be proper. So foot arch is a mandatory part of a child with Down syndrome and throughout his or her life. So these are something about early intervention program and role of a pediatrician. Then third transition is empowered parent. I have used the word empowered because I am sure that if we will do this many things, the parents will be empowered. They will gain confidence nicely. So empowered parent, and we are now, the third transition is to teacher and confident parent and a pediatrician. Now you will ask, what is the role of a pediatrician here when the child is going to school? Yes, this is the job of teaching institute, shadow teacher, whether they are planning individualized training, individualized education plan or not. The entire thing goes to the teaching institute. But for a child with Down syndrome, as such also transition is very difficult. Very difficult, because as I mentioned earlier, they do best in predictable schedule. So if the schedule is not predictable, the transition, even in routine, if you say instead of 10, if you will say that take bath at 9, we have to go earlier, you have to inform the child earlier that tomorrow instead of 10, you will have to take bath at 9. So this much is the issue with sudden doing certain things sudden. As such also, a child, a grown up, a teenager, a young adult with Down syndrome, they have problem with transition. Now think about a transition when we are putting a child in a school. So the child will have to go from home environment, from a protected environment, to somewhere where he will be all alone. He will be without family members. No family member will be accompanying him or her. One thing. Then he will be exposed to new place, new environment, new people, new schedule, new rules to follow. So many things at a time, and there is overload, sensory overload, and there is short circuit inside. So behavioral issues will be at peak. So the child who has been already potty trained, may the child will start passing urine daytime, nighttime. So there are all chances that achieved milestones, there may, for a moment, you may milestones, you may notice the child may get withdrawn, or find the child getting very aggressive. So here comes the role of a pediatrician. If we keep the parents well informed about the transition phases, the first transition, second transition, third transition, then it would be easier for parents to handle the situation, to assume the situation, to find out the solutions beforehand. And that is the role of a pediatrician. One more I forgot to tell: connect the parents with local parent group. It is a big support. So try and connect. I have provided in Gujarat, I have provided in my leaflet, on the back side of the leaflet, I have provided name and contact details of parents, maybe 20 parents I have provided city wise. So you can connect the parent, new parent, with local support group of parents. So then comes the fourth transition. So somehow schooling and most of the children with Down syndrome, if well accepted, and if the school authorities are sensitive to understand, if parents are bold enough to explain and inform the needed persons about what a child with Down syndrome can do, then usually they can cope with the syllabus till 7th or 8th standard. And nowadays it's very good that NIOS is there. So after 8th, but or 18 years of age, they get school environment, maybe regular or special needs school, but suddenly there is a vacuum in their lives, because there is nothing in between, and employability is a big issue. After schooling, what to do? So even we don't have the doctors, society, NGOs, we have very less information about what can be done after schooling. So here there is a very big gap. For this, being a pediatrician, being a doctor, taking care of the child since child's birth, we can guide them about life skill training programs. We can guide them about pre-vocational training program. They have to search on their own, but beforehand we'll have to guide them that there will be a big gap after school days are over, a big gap from schooling to employability. And if you want your child to be employed somewhere, you will have to start searching for life skill training programs, vocational training options, vocational training. Nowadays, there are many, but people are not aware of employment options. There are many private and government has some policies, and there are many private sectors. Now they are ready to hire persons with Down syndrome. But this information we can provide. Now, the most dangerous part of life is if they are not guided after maybe 16, 17, 18 years, whatever age, till the age they are accommodated somewhere, maybe in regular school or in special. Once those years are over, and when the child is not doing anything, he has no life skill training, no vocational training, no pre-vocational training, no vocational training, then there are all the chances to slip into depression. And the rate of adult with Down syndrome slipping into depression is increasing like anything because of the better awareness. Now, people know, they accept, we can see them. Till now, they were not visible. Until now, they were not visible because awareness was not there. So parents were not taking them out because they are visible. So they are exposed to the real world. So now they want everything that their peer are doing. Their peer, their brother, their sibling, sister, all are cousins, all are doing and getting. Now they want that, but they are not getting. They don't have friend circle. They don't have social circle. They can't go alone. They can't travel because we have not trained them for life skills. So they can't travel alone. And because of that, but they have all the exposure. So because of that, they slip to depression, and does not help. Counseling does not help because it is impossible, maybe not impossible. It is very, very, very difficult to make them introspect. So because they can't introspect, we can't do counseling with them. So it's our duty as a pediatrician, as a doctor, as a responsible citizen to stop this happening, to stop the increase. It is increasing like anything. It is so very burning issue. So these are the various stages I have mentioned. What as a pediatrician we can do. Now this is very difficult. The fifth transition, this is medical transition from a pediatrician to a physician. I have asked a few physicians, what are the difficulties you face when you come across an adult with Down syndrome? So most of them mentioned that we don't get proper history. Then parents, they hide so many things. They say, no, he's doing everything. Yeah, he's on his own. He's independent. No, he has no problem, no issues. So physician, they don't get exact condition, what exactly that the boy or girl is passing through. Their pain threshold is higher. So they also can't get the exact intensity of symptoms. So there are many, then physicians are unable about the chronic illnesses like hypertension, thyroid, whether the young adult was taking proper drugs or not, because parents, they will hide. By the time parents are exhausted, so they don't provide correct history. So fifth transition, very difficult, very important transition, is a transition from pediatrician to physician. So for that, we have created the Down Syndrome Society of India has created two passports. Passport 1 till the age of 21, and passport 2 is 21 years and beyond. So I would like you to go through these passports, and for till then I'll have to open one PDF. So till then I will stop sharing, and I will share the first passport and second passport with you. Very meticulously created, and you don't have to think much. You just have to go through each page. You have to uh, click on that, and if it's not, just a minute, just a minute. So this is health, and this is for all of us. This is created by Down Society of India, and this is how it. The medical passport for persons with Down syndrome, this is to be kept with the person with Down syndrome all the time, like we keep our passport. So everything is mentioned here. Everything you need not do. You just have to fill the page, and for each visit we have provided a separate page. So this is the mention whatever has been asked. Even the type of on from the it is translocation or 21 trisomy or mosaic, you will come to know that. Then about birth, Apgar score, feeding history, frequency of feed, whether breathlessness, coughing, choking, cyanotic spells, that will give you so many ideas. You just have to tick mark. This is beautiful. It took 2 years. Many doctors, including me, we have contributed. It is very well made health passport, and I will share this PDF with you, Dr. Swetal, and this is so very good. We should keep this.
Sure, ma'am.
Yeah, this is very, very good. History of gastroesophageal reflux, everything. So you will not miss anything. At the same time, you need not stress your mind कि कुछ रह तो नहीं गया है. Have I missed anything? You need not stretch your mind. Everything is mentioned. Everything is mentioned. And every 3 months for first year, every 3 call the parents for visit. So, and for every visit we have provided a separate page. So these are the basic first visit investigations the child has to go through about hearing and vision, and to the cardiac screening, blood test, everything. And then what specialist you needed on first hand, so that is also you can mention. And this is after 3 months, then after 6 months, then at 9 months. The previous one was at 9 months and 1 year. Then every 6 months, for first 5 years, every 6 months. So there will be 2. And now what we need to add after 1 year of age, when the child is 1 year, what are the things to be added? So that is also mentioned about the developmental milestones, speech, nutritional evaluation, diet, immunization history, everything is mentioned. We have not missed a single thing. So this is after the first visit, after the child becomes 1 year old. So this is about first visit. And then every 6 months, so we have given two pages for first 5 years. You just have to fill that page. The second visit, first year, second visit, second year, first visit, like that. And then I will go. Then once a year. Once the child is 5 years old, then once a year. Then here there will be we have included visual, ENT, and dental. Then developmental history as far as educational formal education is concerned. So that we have mentioned here. Then per year, 1 page per year. So till 12 years of age. Then after 12 years of age, a few things have been added, like schooling and progress, like vocational training plans, like sex and sexuality education. So few things added, and then till 18 years, same process, and 12 to 18 years, and then 19, 20, and 21 years of age. These are the few things we need to ask for: osteoporosis, hypercholesterolemia, HbA1c, and here is the end of the first passport. So if the child has this passport well filled, then there will not be any issue when in fifth transition, that is from a pediatrician to a physician. And then the second passport is mainly for a physician. It is not for a pediatrician. Here the job of a pediatrician is over. So that I have shared vision. If you want, I will share that PDF with Dr. Swetal, and she can post in the group. So this is how we can help the parents when it's trisomy 21. If you have any questions, I am ready to answer.
Thank you, madam. It was excellent sensitization talk to the pediatrician, and it was very much well taken topic of all the disciplinary approach. It was taken very well, and it was really a great job what you have done so far in this field, and it was very a pleasure for us to have you as a guest. I invite madam for the comments.
Yes, well said. As Dr. Monish sir has said, excellent information regarding how different phases transition of Down syndrome we as a pediatrician, as a nodal person, can take care. And ma'am, why I got I thought of inviting you was not only the celebration of Down syndrome on 21st March, the day of our awareness, but in last 1 week, I have diagnosed 2 Down syndrome, a newborn karyotyping 21 trisomy. They were like mothers are just 22, 25 years of age. So I started with my department Down syndrome registry, and just to discharge them and just taking developmentally supportive care was not enough, what I thought. And hence I thought to invite you and get some insight how we can go ahead. I'll definitely share the passport idea is really very good. So we cannot miss anything in this patients. And with the small things which you have told us, like the early sensory stimulation as well as this feeding difficulties, why they do go to the failure to thrive. There are many medical conditions also they faces. Like just last year, I got a patient with transient myeloproliferation in the newborn phase. So these are the things which we should not miss, and this medical passport will help us to remember. Yes, unka thyroid screening karna hai. We have to look for the developmental aspect, their nutrition and growth aspect, and their different transition. So this was really a great session, madam. Thank you so much for coming to our platform. And please share your medical passport to my personal account. I'll definitely share in the group. And even for my patients whom I'm going to discharge after a few days, they will be the first beneficiary of that passport from my side. Thank you so much, ma'am.
And one more thing I would like all the pediatricians to, take care of. Ask the parents not to rush in achieving motor milestones. Because for parents, see, motor milestones are the most visible thing. So the neighbors will say, they now 9 महीने का हो गया अभी बैठता नहीं है 1 साल का हो गया अभी बैठता नहीं है. So they get anxious about, and then they force the child to sit. Now
Yes.
what happens? Yeah. Now what happens? The muscles are not strong enough to bear the body weight, and when we sit or stand, the body weight falls on muscles and bones and joints equally. So when the muscles are not strong enough to bear the body weight, entire body weight falls on the vertebral column while sitting, and while standing in all the joints of lower limb. So early degeneration process in the lower limb joints, and the increasing cases of scoliosis and kyphosis, because
True.
the parents, and they are so very, they are in race. Parents are in race in achieving milestones. So this is one more duty of a pediatrician, to hold them, to explain them, then don't do this. The achieving milestone is not important. Achieving muscle strength is more important than achieving a motor milestone.
Well said, madam. Well said. Thank you so much, ma'am.
Okay, thank you.
Thank you.
Thank you so much, Neena ma'am, for the excellent presentation. It was really sensitizing and motivating us that we have to look more and more, and like the Indian passport is powerful, I hope that the Down syndrome passport is become also very
Yeah, it's
powerful.
very well made.
Thank you so much, ma'am. Thank you, Shwetal ma'am, for
Thank you.
guiding words.
Okay.
Thank you, Monish sir, for conducting the excellent
Thank
session. Thank you so much, ClearNet, for the excellent and seamless this platform. Thank you. Ritu, you can.
Thank you.
Ma'am, can we conclude?
Yes. Thank you so much, everyone. Thank you.
Thank you, everyone. Thank you, dear doctors, for sharing your valuable insights. I hope you had a seamless experience. So, with all your permission, we are signing off for today, and we're looking forward to host you again very soon. So,
Thank
till then,
you.
stay safe and healthy, and have a nice day. Goodbye to all.
Goodbye.
Goodbye.